Welcome to OUTdrive, folks. I'm your host, Cliff Callis, and each week I'm bringing you actionable marketing insights you can apply to reach, connect with, and convert rural American consumers. OUTdrive is powered by Callis, a full-service advertising agency with a focus on marketing rural America. Callis offers a wide range of integrated marketing services, including website development, search engine marketing, social media, video, and digital. We develop strategic and creative campaigns to build your brand and your business, and you can learn more about us at ecallis.com. Now join me in the front seat as we head out on the road to success. Let's go. Hey folks, welcome to OUTdrive. We've got another great story to share with you today about life and work in rural America. You know, the geopolitical climate we live and work in these days is complicated. But when you throw in the healthcare industry in a rural geography in Alaska, it takes an experienced public relations professional to navigate the challenging waters. Bruce Richards is the External Affairs Director for Central Peninsula General Hospital in Soldotna, Alaska. Bruce grew up in our 49th state, and he started his work life in his family's paving business. When his father passed away at a young age, Bruce migrated to politics and government, gaining excellent experience at the local, state, and federal level. When the opportunity to help out his regional hospital came along, Bruce jumped in, guiding important legislation that became part of the Affordable Care Act. Since then, he has helped his hospital grow, expand, and solidify its position as a quality healthcare provider it is today. And he has a great perspective on what it takes to serve a rural population in a remote area. I think you'll find him very interesting. Welcome to OUTdrive, Bruce.
Thanks for having me, Cliff. It's good to be here.
It's great that you're here. I've been excited to get to know you and to talk about life in Alaska. I was thinking back, we're nearing our 250th episode of OUTdrive. I've never had an Alaska resident on, so you're our first.
Well, I'm honored to be the first.
Hopefully not the last, but we've got a lot to talk about. I want to hear what it's like living in Alaska. I've never been there. I've heard stories. I want to talk about how healthcare communications continues to evolve and your role at your hospital. I want to talk about some of the challenges of providing rural healthcare, because there are some, and there are lots of other things we can talk about. Let's start by having you introduce yourself and just tell us a little bit about yourself.
So, lived here most of my life, came here from the Midwest, moved from Minnesota. A lot of Midwestern families seem to have populated Alaska. I think it has something to do with the harsher winters, and people are okay with that. So we were part of that. It came up. My dad went to work in the oil and gas industry. You know, that was the big boom going on at the time. And where I live here in Kenai Peninsula, there's a lot of oil and gas activity. There was a lot of time. It's kind of winding down now, but that's what brought us here. My dad worked in Minneapolis and was in a business that he didn't like being in, and where he had to wear a suit and tie. It's kind of funny. Here I am wearing a tie, but he was wiring. They weren't personal computers. They worked for a company called Control Data, and they made computers that our iPhones today would take up the size of this room, and they were wiring, soldering tubes and all that kind of stuff, and wearing a coat and tie while they did it, and he hated it. And next thing I know, we're in Alaska, and I was 5 years old.
That's quite a change.
Yeah, it definitely was. And I live in a small town here. The Kenai Peninsula is in the southern part of Alaska, so it's just directly south of Anchorage. We're on the coast. The world famous Kenai River is here, where the world record king salmon was caught. So there's a lot of tourism. It's kind of a microcosm of Alaska where I live. It has a little bit of everything. I mean, it has natural resources, oil and gas. It has tourism, all of that kind of stuff. So it's an interesting place to live. It's a great place to grow up. Again, it's small. It's about 60,000 people in total on the entire Kenai Peninsula. And for our hospital, about 2/3 of those we consider in our service area. There's 3 hospitals here on the peninsula, and they're all separated by 75 miles is the closest one, and that would be a critical access hospital. And then there's another critical access hospital in Seward, which is 90 miles away. And we're kind of a tweener. We're an in-between. We're too big to be a critical access hospital, but we're not a big tertiary care center. So that's up the road in Anchorage, 150 miles away.
Well, we'll get into talking a little bit more specifically about some of the services that you provide, your geography, but tell us how you got involved in healthcare.
Yeah, it's kind of a crazy story, to be honest with you. After my dad got tired of the oil field, he started a construction company, a paving company, and I worked in that as a kid in high school and through college. And he suddenly passed away, and he was in a partnership, and that's a long story. But, anyways, we weren't in the paving business anymore after that. It was a deal where it took care of my mom, and the partner bought her out, and that was all fine. But I had to find something else to do, and I ended up, of all things, going into politics. A friend of mine had gotten elected to the legislature and wanted some help in Juneau. And so I moved to Juneau, and I didn't know anything about politics at all. I actually kind of grew to like, I don't care for partisan politics, but the machine and how it works and how things get done and public policy is made. And I developed an affinity for that. And so I worked in politics. I worked in the legislature and for the governor for 15 years or so, I suppose, and the mayor of Anchorage and mayor of the Kenai Peninsula Borough. And then politics isn't really a great living for a family life, with elections and things. One day you find out you don't have a job after an election. And so I needed something a little more permanent. And I was actually recently fired by a newly elected borough mayor, and the CEO of the hospital needed some help with a political issue, some legislation back in Washington, D.C., of all things. And so he called me up and said, "Hey, I need some help." And been 15 years ago, almost 16 years now, I guess, and been here ever since.
Kind of a win-win, sounds like.
It is. It's great. I love this. I mean, I didn't know anything about healthcare. It was kind of like when I got into politics. Didn't know anything about that. I didn't know anything about healthcare, but helped them get their issue fixed, which was kind of a crazy story. I mean, I ended up going back to Washington, D.C. and working on this issue that only impacted 15 hospitals in the country. It's called the Rural Community Hospital Demonstration Project, and it's for tweener hospitals. Need to get that reauthorized, and I ended up getting an amendment put into the Affordable Care Act, of all things. So it was a crazy time. I was back in Washington when everybody was arguing about this big bill that was sucking all the oxygen out of the room at the time, and I didn't know if I wanted to hitch my wagon to it because I didn't know if it was going to pass or not, but it was the only thing moving. And yeah, I ended up getting an amendment in there and getting this thing reauthorized for 5 years, and I've done it 3 more times since then.
That's awesome. Congratulations. Sounds like quite the coup.
Yeah, it was interesting.
Always is. Well, tell us about Central Peninsula Hospital.
Yeah, so we're a 49-bed hospital. It opened in 1971. I had moved here a couple years before that. It was a hospital that was started by some docs. It was a private venture at that time, and they had gotten a small business loan from the federal government. And as everything else in Alaska, and nothing goes according to budget, and they ran out of money. And basically, it was a boarded up block building, that was kind of dried in at best, and basically had the walls and the roof on, and then everything was all boarded up. In fact, we used to break in here and play around on the cement slab when we were kids. But anyways, it opened in 71. I think at that time, I might be wrong about this, the number of beds. I want to say there was 24 beds. They were all dual occupancy rooms at the time. But it's evolved incredibly since I've been here. I kind of came here right at a big transformation of this hospital. They had just sold $50 million worth of bonds to build a new tower, as you call it. It doesn't look like a tower, but we all call them towers in hospitals. And our med surg unit, so we have 34 beds up there, and we have 9 intensive care beds up there. And at the time, we were struggling with having the problem that a lot of places do where people, when you turn 65 and you get this letter from your doctor, it says, "Hey, congratulations, happy birthday. You need to find a new doctor because I don't do Medicare." And the hospital is owned by the borough, counties where you live, but it's operated by a not-for-profit organization, which is where I work. And the borough took over this hospital from the docs when it was failing. The place was booming. We had all this oil and gas activity. We had a lot of industrial accidents and things, and help was a long way away. So the borough took it over by a vote of the people, and that's how it kind of came into existence and got finished. And when I got here, like I said, we just had this big bond proposal, and the voters voted for it, and we built this new tower and had this Medicare problem. And the CEO at the time said, "Yeah, I'm going to fix that." And so he bought a medical practice from a retiring physician that stayed on for a little while, and we made it so that practice took everybody, regardless of their ability to pay. So Medicare, Medicaid, everything. And ever since then, that has been our model. And it's kind of a unique model in Alaska. Most hospitals in Alaska are not like that, but we have many, many practices now, and the majority of physicians in town here are employed.
That's similar to our situation here. To me, a lot of physicians are realizing that running a medical practice is a different animal than providing healthcare. And the hospital can take on that business role and the technology role and the paperwork and all that kind of stuff that allows a physician to just concentrate on what they really went to school to do.
Yeah, but it is still pretty unique here. For whatever reason, I'm not sure. But if you go up the road to Anchorage, the biggest city in Alaska, they have a huge Medicare problem, access problem for people that are joining Medicare. They still can't find a provider. There's been many stops and starts of clinics up there by for-profit hospitals, not-for-profit hospitals, and one recently closed, and there was a lot of clatter about that. And it always comes up in the legislature, and they seem to throw money at it. Some physician has a great idea about how they can run a Medicare clinic, and somebody throws money at that, and then they close. And so, but it's worked out well here, and the model has been very beneficial for the hospital. I think it kind of feeds on itself, if you will. I think that being the only hospital in town, obviously we have benefits having the physicians that work here and refer things to the hospital. So it's a beneficial relationship as well.
That's for many people a unique situation to be the only hospital in a market because it is a market to itself, right?
Right.
So, what are the pluses and minuses of that?
Well, I guess if you think back to when I first got here and we bought that first clinic, we're one of the few hospitals that's financially successful, which is a pretty tough thing these days for a lot of hospitals. I read about closures almost every day or threats of closures. But one thing that it allowed us to do was to bring a lot of service lines from up the road down here. So that money was getting spent. People still needed health care, but it was happening somewhere else in a different market, as you say. And so by capitalizing on that and bringing services closer to the people, well, obviously ones that make sense, you're going to have volume in order to do that. But we have managed to bring a lot of services here. And that's been, a financial success for the hospital, but more importantly, a big win for the residents and the patients here. A great example is my dad died of cancer when he was 48 years old, and we couldn't take care of him here at this hospital at that time. That was in the late 80s. So my dad died up the road in a big Providence hospital, in Anchorage, and we weren't there at the time. They told us to go home. He was kind of stable. And so being the geography that it is, we're 150 miles away. And then at 4 a.m, our phone rang and said, "Hey, things have taken a turn for the worse. You need to get up here." Well, it was in the middle of July. The fishing season's going on here. There's tourists everywhere. There's no seats on the commuter airplanes. And I threw a fit in the airport trying to get my mom a seat to get up and see her husband one last time. And one lady I finally guilted into giving up her seat and got mom up there, but she was still 2 minutes late. So it's changed a lot. Yeah. Back to your point about markets, I think bringing those services home has been a huge benefit to the residents here, and it's also been a financial success story for the hospital.
You did make the special note that financially the hospital is very solid. And you're right, there are a lot of rural hospitals and really hospitals all over that are struggling financially. What is it about your hospital that allows you to function in that way? What's different about it?
A lot of it has to do with geography just in and of itself. Like you said, we're the only hospital within 75 miles, and that is a step down in care. It's a great hospital, but it's a critical access hospital, and we have far more services here than they do. So we're kind of a collective point for some of those hospitals. They send people up our way even. I think it really boils down to geography. When I go to places like we were just talking about, San Antonio for the Rural Health Conference, and you hear about critical access hospitals that are competing within a market with bigger hospitals or even other critical access hospitals that aren't very far away from them. And we just simply don't have that. It's just non-existent. We are the only hospital. We're the only game in town.
So, what's your message to your audience?
Well, the audience here or your audience, I think that every place is different. Obviously, we have found a recipe that through great board leadership, great CEOs over time that have figured out to kind of crack the code that makes us a financial success, but like I said, more importantly, able to provide pretty high level care for the patients and residents here in the Kenai Peninsula. And so a lot of things have changed. Like I said, we weren't able to take care of my dad, and now we have a cancer center here. We have a couple of hematologists, oncologists here. We have a lot of specialty services. We have 3 spine surgeons. We have a lot of specialty services that we just didn't have at the time, and you had to leave. And so when you leave, you kind of have to leave your support group behind, your family sometimes, only maybe one person can go with you. You got to find a place to stay and recoup and all that kind of stuff. And now that all takes place here, I mean, just opening radiation oncology here, oh, I think it was in 2014, people used to have to go 150 miles up the road for a 20-minute daily radiation oncology treatment. And for some who are more wealthy, they flew up and back every day. For others, they drove up and back every day. That's a 6-hour road trip total. And then others would just go up there and stay till their entire treatment regimen was done. And so now that's here. You can come in, get your treatment, go back to work. It's a whole different game.
So let's talk a little bit about your specific role. I know you didn't use the word lobbyist, but that's sort of the role that sounds like you were playing. What's your role evolved today?
Yeah, so I'm probably a pretty unique creature in a hospital our size. The word lobbyist comes up. Being the director of external affairs, I mean, obviously we're owned by the local government, so there's an interface there that we keep everybody informed what we're doing. We have to go get their blessing to do things because they own all of the assets here. We don't own anything, the nonprofit that I work for. So you have to go get permission and talk to the assembly and the mayor. And so there's that interface. And then, of course, as you well know, I mean, hospital and healthcare politics is kind of crazy. It's one of the most regulated industries in the country, and there's a lot of things that happen, good or bad, that you probably need to inject yourself into. So I would say, where the lobbyist role comes in, I'm getting ready to leave for Washington, D.C. on Saturday. The Rural Hospital Demonstration Project I was talking to you about that started my role here, we're about to exit that because we can't stay within the bed cap requirements for that's a 50 bed cap. And just recently, our daily census, we've been exceeding that. Our hospital's full all the time. It is full. We are the fastest growing 65 plus age cohort on the road system in Alaska. And why is that? A lot of reasons, I don't know, but we're aging here more rapidly than everywhere else in Alaska. And as we know, as you age, your consumption of healthcare services goes up exponentially. And so we're trying to prepare for that. We're in the middle of master planning now. The hospital's full. We have a long-term care facility that we also own. It's full. And like many other hospitals, we have problems moving people through the system. There are people in here right now that we just don't have a safe discharge for them to go to. There's no reason for them to be here. Some sort of a post-acute care option really doesn't exist. So we have a lot of problems like that. And so that coming back to my role, that's kind of things that I work on and try to help solve.
So do a lot of people in your area use the hospital for acute care because there isn't another option within 75 miles?
There's some of that for sure, like every place. Obviously, we run an urgent care here. We own all the practices. They're all available to patients, but it's just getting harder. We recently had like a state issue, for instance, where the state guardianship program has been overwhelmed and there was some trouble there. And I'm not really sure what it was, but it got very backed up. And so you end up with people in your system who are under a guardianship situation and the guardians are overwhelmed. They have way too many cases. And so it's kind of like, hey, well, this person is in a hospital. They're being taken care of. They're warm. They're being fed. I got other fires. And so you don't get the attention that you need to move them on to a different setting or level of care, and if there even is one. So it's not just so much that people use the hospital as their family practice physicians. It's a lot more complicated than that. And then throw in the aging factor and, the higher prevalence of Alzheimer's and those kind of things that we see a lot more of today. Yeah, it's kind of a perfect storm.
So being in the geography that you described having a lot of tourism in the area, fishing is strong. What are some unique characteristics of the kind of services that you provide as a result of that?
One of the more unique things is when the fishing season starts winding up here, this town swells. I mean, the population increases exponentially with tourists. So that in and of itself means there's more car accidents. Everything gets elevated a little bit. But one thing we do see a big increase in that we don't see the rest of the year is fishing hooks, fish hook removals. And it's kind of unique. I grew up here, and like anybody else, I go stand in the river in my waders and catch sockeye salmon starting in mid-July through August. And it's wall-to-wall people. And there's a certain technique that people use to catch these fish. And it revolves a lot of stress on the line. And then if the fish gets off, that line lets go and it comes directly at you if you're not paying attention. And so we get a lot of fish hooks in face and in your head, basically. I mean, we have a thing in our emergency room department, it's a mannequin where every hook they've removed from a person, they put it on the mannequin where it came out of. And more so is these fishing lines have a sinker or a lead on them to help weight them down when you're casting out. And those cause some pretty significant injuries, hitting people in the eyes. And I mean, I've seen them go underneath people's eyelids into the back of their eye, where they basically have a lead behind their eye with a fish hook string coming out and a hook dangling, broken orbital bones. It's kind of crazy, but that's probably the most unique thing that swells here during the tourism season.
That really is bizarre to think about.
Yeah, there's a lot more activity on the water, a lot more boats. And so we have boating accidents and drownings and near drownings where people get brought here. And so, yeah, that stuff ramps up. But yeah, the fish hooks and sinkers are probably more dangerous than the fish hooks, to be honest with you. It's the craziest thing I've ever seen. And, knives, people are filleting fish and cut their hands wide open. It's interesting.
Sounds like it.
Living in a pretty interesting place. I woke up at midnight this morning to almost a 5.0 earthquake. My wife sat right upright in bed, and I was asleep, and I didn't really realize I slept through the earthquake. But when she sat up, I didn't really understand what was going on. I wanted to make sure everything's okay. And I said, "You all right?" And she says, "We just had an earthquake." And I said, "Oh." Look it up, and it was a pretty good shaker just 45 miles away from here. Having quite a bit lately.
Interesting. Any damage?
Now, I lived in the same house for the last 16 years, and I think the biggest one we went through was a 7.4 or something like that. And that's when things start falling off walls and tipping over. It's unnerving, but it doesn't cause any damage.
That's good. Well, you said earlier that you like to fish during the summertime. It's not the only time to fish, though, right?
No, absolutely not. People fish all year long down just south where the other hospital is in Homer. There's a great winter king fishery down there, and it's fantastic. And crabbing and all kinds of stuff goes on there all year long.
So, what else do you like to do when you're not working in Alaska?
Oh, the outdoors, obviously, we don't have the greatest of weather. So when you get really nice days and getting out in the boat and doing that is really relaxing and fun to do. So spend some time on the boat, play golf. I have two daughters that play golf. Taught them how to golf here in this little podunk town, and they both ended up getting Division I scholarships and playing golf. And I got one playing in Alabama right now, and the other one just graduated from New York. And so golf has been part of my life. We got a little 9-hole golf course here that they learned on. So that's been kind of fun. We enjoy that. But yeah, mostly the outdoors and working around the house outside and enjoying the weather. We have bald eagles that nest in our backyard, and we watch them, and their eaglets grow every year. But I think we're not going to get to see that this year. We had a huge windstorm the other day that was approaching 100 miles an hour, and their entire nest blew out of the tree. So I think we won't be getting to watch that. They're still around, but they're not nesting there this year.
A lot of times they'll come back to the same spot, though, right?
Yeah, I'm told that's true, but there was an abandoned nest just over a couple houses down that I think they moved into. So yeah, maybe, but we have a lot of wildlife. I had moose in my yard yesterday, and a lot of that I have to look out the door before I let the dog out because you don't want them getting tangled up with a moose. And we have some bears here. At my house it's twice a year when they come down and they make their way down to the river, which is just down below where I am at, and they spend the entire summer at the river. And then in the fall, when the fish dry up, then they wander back through. But it takes them a couple days to get through the neighborhood. They're not very fast. And so you kind of got to pay attention to that.
So the lifestyle that you're communicating is rather unique. Do you have a challenge recruiting physicians and other healthcare professionals to join you?
Well, I suppose we do, but the answer to that is fortunately we're successful financially. And how do you get somebody to come where you want them to come is you have to pay them. And I think that has been the answer that helps us recruit a little better than somebody down the road who can't quite pay as much. To be honest with you, I think that's probably the answer that solves our recruiting problem, if it did exist, is money solves a lot of things. And so you end up paying a premium to get people to come here, but it's worth it. And so far, it's still working out financially for us. And so that's our answer for recruiting. But I totally understand that that is not the case for every hospital. And in fact, it's, usually the exact opposite. A lot of people are struggling to make payroll, and subsidizing paying a premium for physicians is out of the question. We are very fortunate and blessed to have the position that we have.
Yeah, and I guess a part of that, as I think about it, is you have some unique benefits being able to live in your area, just like we have unique benefits living where we do, or anywhere in the country has its own fit, I guess. And so finding those people that want to live an outdoor lifestyle, that don't mind the extreme weather at times, I think that's really kind of the key, it sounds like. I mean, the money obviously is important, there's no doubt.
I think you've hit on something though, and we find a lot of people that are very much want to live out of the city. It's kind of, I think of my dad when I think of this situation and didn't want to be in the city anymore and the hustle and bustle of traffic. I mean, I live 3 miles away from the hospital and it takes me 6 minutes to get to work, and I have one stoplight to go through, and I think that that appeals to a lot of people, and we get a lot of physicians that are younger that we get coming right out of, residency, and they have young families, and it's a great place to raise kids. And when we talk about extreme weather, it's really not that extreme like people might think of Alaska. I know they think of, blowing snow drifts and polar bears. I've never seen a polar bear. They're not even close to here. But when I first moved here, winters were a lot more difficult. They were very much on the colder side. And, we would have, I can remember as a kid, we'd have cold snaps of 20 to 30 below for a couple of weeks. And now we don't have that at all. When I was a kid, we'd probably trudge through a couple feet of snow on Halloween, and now it might frost on by Halloween. It's totally changed. And so, yeah, getting back to the physician point, I think we attract people that want to live in that lifestyle, have the outdoor recreation, have a good place to raise kids, not be in a big city. And yeah, it seems to work.
Do you ever hear, I'll call it a misnomer, that I'm going to go to the city for health care because the health care is better? You ever hear that?
Sure. Oh, yes, absolutely. It still exists to this very day. Even here, bigger hospital provides better care in some people's mind. And of course, those of us that work in this industry know that that's probably not true at all. And in fact, I would argue that you get better care in a smaller setting. You get more personalized care, first of all. It's not as busy and less stressful. So yeah, definitely hear that. And that's part of letting people know what you have here, what's available, and part of the marketing side of this, which is another hat I wear here, is letting people know what services are here. Because until you need them, you don't really pay attention to that, right? I mean, nobody's looking for an oncologist until somebody tells you have cancer. Nobody's looking for a spine surgeon until, boy, your back really hurts and you find out you got a real serious problem. So part of our job is making sure that people know that those services are available here, and that we have an incredible medical staff here. It's a very well-run medical staff. They're very selective about who they let in here. Everybody's board certified. It's pretty tough to get in here.
You mentioned marketing. What do you see hospitals doing from a marketing perspective that you think is very effective?
It's an interesting animal. I mean, especially for me, you're the only hospital in town. It's not like you're having to compete with a competitor and say, pick ours over somebody else's. So there's that piece of it that we don't really have to contend with. And I think our biggest thing is trying to promote wellness here in the community, try to keep people out of the hospital, be quite honest with you. And we do a lot of our marketing based on that, taking care of yourself, getting your checkups and your screenings, and find something out ahead of time where you can take care of it early. And so I see a lot of marketing from the bigger hospitals up the road, and they want to talk about their stroke care program is the best in the country, or they got some gold, whatever, but I think that people really do want to get their care close to home as long as they know that it's good care. And I think that we've threaded that needle by making sure that we have a great medical staff and we hire great physicians. And we just need to let people know through marketing that they're here and available to them should they ever need them.
I'm guessing that community relations is an important part of what you do too. You probably get the opportunity to sponsor and participate in all kinds of community events.
Yeah, we definitely get an opportunity to do a lot of that type of stuff. And we try to focus on specifically healthy activities and health related sponsorships.
So do you do all this through an in-house marketing department of some sort?
Yes. So when I got here, there was one person in the marketing department, and now we have three, which has kind of been a recent run up, but we've taken a much more active approach in promoting the wellness and community health side of things. And obviously it takes some resources to do that and some skills. I used to do all the web stuff, and it just became too much, to do anything that was really worthwhile that actually produced anything. So trying to ramp that up and make things more accessible to people electronically. You don't have to print out a form and fill it out and bring it back, doing electronic kind of things. And we have a long way to go, but a lot of that stuff has been taken care of. But I would love someday for people to be able to pre-register via their devices or whatever when they walk in. We're not quite there yet, but someday.
So what's a typical day look like for you? I know you said you're getting ready to go to Washington on Saturday. What's today look like?
Well, in a couple hours here, I have a bill hearing in the Alaska State Legislature. So kind of a unique situation again to my position. I spent, it's almost a year now, but starting in May last year, there was a bill going through the legislature that was going to kind of rein in the prior authorization process here in Alaska. As you know, at the federal level, they've taken care of a lot of things in the Medicare and Medicare Advantage side of things. But in the commercial market, it's still kind of the wild, wild west. And patients suffer when their authorizations are delayed, denied. And so there was a bill last year, and it died a very painful public death based on a letter from an insurance company that I didn't think was very accurate at all. They basically threatened to pull out of the Alaska market, and there's not many players here. But it was a straw man, and it really made me angry. So I started in May, and by I guess it was November, I had drafted a new bill. Personally, I asked my CEO, I said, can I take this on? I really want this. I don't like how it ended. And if you want something done right, you got to do it yourself kind of thing. And so I spent the entire summer in the interim of the legislature drafting legislation. And then I did something a little bit unique. I went and talked with all the payers and the regulators and the docs, and I got everybody in the same room. And I didn't do all this by myself, but I kind of was the catalyst for it all. We got everybody in a room and said, hey, look, this process is broken and it needs fixing. So let's hammer out something where we can all agree on it and everybody put their hands in the middle and everybody support this as it's going through the legislature. And we got there. We have a bill that I think is really good. It actually moves the needle on prior authorization and sets some pretty strict time limits on payers getting back to people and some transparency and all those kind of things. And we kind of checked off all those boxes. And I was surprised to get as much out of the bill as we did. I mean, of course, I overdrafted it knowing some of it was going to go away, but I'm very happy with it. And it's moving through the legislature at a pretty good clip right now. So have a final committee hearing in the state Senate today, and its next stop will be the floor of the Senate. The House bill, the companion on the other side, has been moving along. And so the Senate bill will move over and join up with the House bill, and I'm hoping to have a bill here. The legislature's got 30 days left, and I'm hoping to have a bill before the end of the session.
Well, congratulations. That'd be awesome. What do you think it takes to be good at your job?
Well, I would say more than anything is networking, having relationships with people on the political side. I used to do that for a living a long time ago. I do it for a living now in a different sense, but I still have relationships in the Capitol building from 25 years ago, and people are still working there, and those matter. And knowing the other hospital operators and my colleagues in the bigger hospitals. A lot of smaller hospitals don't have my position, but having those relationships and being able to talk things through and let everybody know what you're doing and what your intentions are and trying to solve some of these problems. Networking is probably the biggest thing. It's why we go to these rural health conferences, and I learn stuff when we go to those. I'm going back to Washington at the end of the week. I'm working on a bill that is going to try to replace the program that we're exiting because of our bed cap space. So having relationships and networking is the best thing. I'm pretty much on a first name basis with our congressional delegation and all their staff, which is, I think, also somewhat unique just because of the geography, and we don't have a huge population. We don't even have 1 million people in the entire state. So knowing your congressional delegation and their staff, that's all hugely important for what I do.
I could understand that. And of course, relationships are so important in business today. And that opportunity is there for anybody, but you got to have the initiative to want to do it and then know how to go about it, how to nurture the relationship and maintain it over a long period of time. And there is a talent to that.
Yeah. And I think we've all been in positions where things don't go your way or somebody does something that's very detrimental. But one of the things that I've lived by and tried to teach my daughters is don't burn bridges. Life's way too short for that. And I can tell you many circumstances where I wanted to burn a bridge so bad. I was so angry about something, but I didn't. And years later, it comes down where you need to work with that person again and in a whole different capacity. And if you had burned that bridge, you'd never be successful at what you do. So I just let things go and move along, and that has served me well.
Yeah, that's great advice. You can't have too many friends, can you?
Nope, you cannot. Not in this business.
Hey, as we wrap up today, Bruce, first of all, I want to thank you for being a guest on OUTdrive. Really enjoyed visiting with you, and you've opened my eyes a lot to what you're doing in life in Alaska. What else would you like to share with our audience that you think they might find interesting or maybe inspiring?
Going back to the model that we have here, I think that was a big leap of faith by our board and our CEO at the time and the CEOs that have been here since then. Things might seem scary, but I think you have to try new things and new systems of operations, even if they're uncomfortable. I mean, we're in some pretty uncomfortable times right now. We're in the healthcare space staring down a lot of unknowns and uncertainty, but what we do know is it's going to be painful. Whatever it is, there's going to be pain involved. And so being prepared for that, I'm constantly watching that at a federal level, which is going to in turn shift responsibility to a state level. And do they take up the mantle, or are you just going to end up with a huge amount of pain through this process? Because I can tell you right now, the state of Alaska financially is in no space to take any kind of a hit from a federal Medicaid type situation. If the federal government backs out, there is no money at the state of Alaska to backfill it. So it's going to be painful. And so you have to try new things and you have to plan things out and game things out. It's like a chess. You got to be 5 moves ahead all the time. And so that's kind of what I spend my time doing, trying to keep everybody here informed about what I see coming down the pike. And I think that's probably some of the advice I would give is look down the road and try to plan ahead. I realize we're all in our day-to-day business and trying to plan for the day, but you got to look down the road.
Great advice. Bruce, thanks for being with us this morning.
My pleasure, Cliff.
Folks, thanks for listening to OUTdrive. I hope you've enjoyed our visit today with Bruce Richards, External Affairs Director for Central Peninsula General Hospital in Alaska. If you liked it, go out and give us a nice rating and review, and come back again next week, and I'll take you down the roads of rural America, where it's heaven on earth.
Thanks for taking a ride with us on OUTdrive. This episode is complete, so head on over to ecallis.com for more insight you can apply to help drive your business growth. And be sure to sign up for our free monthly e-letter, OutThink, for even more helpful content about marketing to rural America. Have a great day and keep on driving.